Well, today on the show, we're back at the South Mississippi Surgical Center over in Ocean Springs. We're talking to a couple of the hernia surgeons that they have here today. Dr. Simpler, Dr. Dvorak, thank you for being here on the show. Dr. Simpler, let's start off talking to you about hernias and everything, but at first, tell us a little bit about yourself.
Well, originally from Dothan, Alabama. I went to medical school in undergrad in medical school at South Alabama in Mobile, and then did my training for 5 years in Birmingham, and been with, after that, joined South Mississippi Surgeons and been here for 4 years.
Well, tell us exactly what you do here at the South Mississippi Surgical Hernia Center.
Sure. You know, our goal with a hernia center and developing this was to sort of specialize in the focus of hernia and the sort of create a center of excellence for hernia and hernia repair. And, you know, our goal is to get people, you know, better and, you know, better faster, regardless of how, you know, complex their issue is with the hernia. And we have developed a multidisciplinary approach to the hernia and dealing with complex hernia issues. And our goal is to provide the best hernia care on the coast and, you know, and in the state, and that's what we're going for here.
Now, you keep saying just hernia. Are there different types of hernias?
Sure. Yeah, there's several different types of hernias. Some of the hernias that we hear about a lot are, of course, inguinal hernias, umbilical hernias, and then hernias from previous operations where people have had abdominal wall surgery or abdominal surgery and ultimately develop a hernia from that. And so our goal is to repair these types of hernias in the most minimally invasive way possible to get people back to work with
minimal downtime,
limited pain, limited downtime. So
now, I've had a hernia a couple of years ago, and I contributed it to, I was working out in the yard, laying sod in the yard and doing all that, and next thing I know, you know, I'm at my doctor for a regular checkup. And I said, I got this thing that keeps popping out here. It's like a little bulge. I could pop it back in, and a little bit later it'll pop back out. And he says, you have a hernia. So what kind of difference, I mean, besides that, I guess, you know, I always hear you lift something too heavy, it could cause a hernia. And is that true?
Well, it's more of a progressive problem. Over time, as we age, we have natural defects in our abdominal wall. And so over time, as we age, those defects enlarge. And as we work throughout our lives, those you get basically an enlargement of that defect, and it causes a hernia. And so it's sort of a progressive problem, and thankfully we have more advanced techniques to sort of deal with those issues.
Well, you hear a lot of you know, especially during football season, a lot of these football players, they got a hernia, or they've aggravated a hernia or something like that, to where they have to have surgery or treatment, because they can be extremely painful to a point.
Absolutely. And then that's the most common complaint is pain, discomfort, sometimes swelling or a bulge, especially when lifting or you know, going through the normal activities. And so that's some of the things that we worry about and that we look for. And it can get to a point where you get a bulge that can't be reduced and and that becomes an emergency. And so we like to address those issues and address those types of hernias before that becomes a problem. And we're increasingly able to do that with you know, less downtime.
Because, you know, one of the things with mine is, yes, I had the bulge. It could pop in and out. It was kind of funny for a little while, but then one day it was like it was on fire down there, to the point where, okay, I've got to get something done. So, and that's when I decided to have the surgery, and I mean, I haven't had a problem since.
Yep, and that's what we strive for with what we have going on here.
Well, we're going to talk about some new techniques for hernia treatment, and we're going to talk to Dr. Dvorak about that. We're here at the South Mississippi Hernia Surgical Center in Ocean Springs. Now, once again, we're here at the South Mississippi Hernia Surgical Center here in Ocean Springs. And Dr. Dvorak, good to see you, sir.
Thanks for having me.
Thank you very much. And if you would, like Dr. Simpler, give us a little bit of background about yourself.
I attended medical school at University of Tennessee, Memphis. Went on to serve 4 years in the Air Force as a flight surgeon. Then completed my surgery training at University Medical Center in Jackson, Mississippi. I've been with South Mississippi Surgeons since 2003, which is the year I finished my residency.
Now, as far as new techniques for hernia treatments. Dr. Simpler was talking about different types of hernias that you can get. What are some of the new techniques for surgery?
Well, the new techniques are aimed at less pain and earlier return to full function. We've done laparoscopic repairs for a long time, but now we can do a laparoscopic repair with minimal fixation of the mesh, and the fixation is what really causes the pain.
Mm-hmm.
We use very few sutures, in some cases no sutures, and the tacks are just minimal as well. We also have a new local anesthetic, which is called Exparel. Lasts for 3 days, and in many cases this allows us to fix inguinal hernias with no post-op narcotics whatsoever.
Now, what made you decide to focus your work on hernias?
I think it's the anatomy. It's just an interesting part of what we do. As general surgeons, we do a wide range of operations, but as far as the anatomy, I think the anatomy is very interesting, especially with inguinal hernias.
Mm-hmm. Now, here at South Mississippi Surgeons, the Hernia Center, the treatment center, explain your comprehensive approach to things, the way you do things.
Well, not every patient is the same, and many patients require a multidisciplinary approach. We offer smoking cessation. We have a bariatric program for folks that need to lose a little bit of weight before surgery. And so each patient has a tailored approach to their repair.
Now, and most people might think of, well, guys are the ones that we usually the ones that you think of surgery because, again, sports injuries, things like that. But women can have the problems too.
Right. Inguinal hernias are almost exclusively in men, but women can get inguinal hernias or groin hernias. Women also seem to get incisional hernias a little more frequently, and that's really where the Hernia Center can offer a benefit. Dr. Simpler was talking about incisional hernias earlier. That's one of the most difficult types of hernia to treat. And the first time you fix an incisional hernia is really your best chance for obtaining a repair that's going to be a long-lasting, lifelong repair. And that's where a lot of our techniques come into play to prevent that recurrence, which is really the beginning of a bad problem. And once you get one recurrence, you tend to get more. And hernias that come back are very difficult to fix.
So I need to think twice about resodding the front yard again, huh?
Well, you're more than 6 weeks out, so you should be okay.
Well, good. Well, I tell you, if you want some more information, website is South Mississippi Surgical. Well, it's smsherniacenter.com. It's on your screen if you want some more information. They have 3 locations: Ocean Springs, Pascagoula, and Biloxi. Dr. Dvorak, Dr. Simpler, thank you so much for being on the show here again. Great information. Again, if you need some more information, you think you might need a hernia surgery, give them a call.